Chapter 20, Adaptive Sexual Behaviors, Sexual Dysfunctions, Gender Dysphoria, and Paraphilias. So the aspects of human sexuality, we all have a genetic sexual identity, and that is determined by our chromosomes, and we have no control over that. Our gender identity is our perception, whether we perceive ourselves as a male or a female, and how we look at that. Then there's the gender role, and sometimes these are cultural. What are expectations about the behavior, depending on whether you're male or female, what you should be thinking, your values, your emotions, and what occupations are appropriate according to your gender. Um, this has changed a lot over the years, except for some cultures who still have very specific gender roles. Especially in the United States, things have changed where we're not locked into a definite role. Then the sexual orientation, that is a gender that you are romantically attached to. So why is this a part of nursing? There's a lot of things that, sexuality is a normal part of life, and um, threats to our health will cause that part of our life to maybe be in jeopardy. Um, Pain can do this, changes in our health status can do this. Um, and it's part of our normal growth and development from when we're in grade school and we're teaching appropriate touch to grade school children, to the elderly who we're teaching maybe about sexually transmitted diseases because it wasn't part of their lifestyle when they were young. And with new drugs that have been developed, people are sexually active later in life. And because um, nurses are really responsible for doing a lot of education for patients, we must be able to have these conversations when it is appropriate. So this is the definition of appropriate sexual behavior. Should be between two consenting adults, mutually satisfying to both, not harmful either psychologically or physically, and there should be no force or coercion involved, and located in a private setting. So when we assess a patient, sexual history is part of that. Um, we're going to focus on sexual health and how it impacts whatever is going on with them medically. We can ask open-ended questions that will promote the patient from feeling like it was okay for them to discuss this with us. Some people may be hesitant to bring up things. Um, One of the many things, the SSRI medications, when we do patient teaching, um, the SSRIs have a tendency to cause a lack of ability to reach an orgasm through sexual contact, and that can be very disturbing for people. Um, and it's not something that they may feel really comfortable with discussing. So it's one of those things that we need to bring up when we're doing education and tell them that, this is a possibility. And if it does happen, let your provider know because there are steps that can be made. There are other medications that can be tried in the same category that may not affect them in the same way as this medication is. So if they know that ahead of time, they may feel more comfortable bringing that up should that happen. Um, we do want to ask direct questions. Um, we want to know about abuse also. Past and present sexual abuse, especially in mental health, is a huge part of an assessment because people with mental illness seem to have more evidence of having some sexual abuse in their past history. Um, that's one of those stressors that can cause people to have more problems. We want to make sure that we speak to the patient at their level of knowledge, not using big medical terms, and be sensitive to cultural backgrounds. If we know someone is from a cultural background where they are not comfortable with maybe discussing something with someone of the opposite sex, maybe we should find someone else to talk with them. Or other ways to get information or give them information that will be acceptable to them. So this slide just talks about what a sexual dysfunction is. And this slide kind of goes through the different ones. Your book has a lot of information about this. Um, Nurses are not sex therapists. Um, a lot of times if you do identify someone who has one of these sexual dysfunctions, what they need to do is talk with a therapist or have some medical intervention to see if there is a medical cause causing them to have these issues. The statistics say that more women than men have sexual dysfunction, that comorbidities can be mental health disorders, obesity, sedentary lifestyle, and these can come from biological factors and psychological factors. Erectile dysfunction has gotten a lot of TV time recently, and this can be an issue for men who have some type of cardiovascular or endocrine disorder diseases that can cause them problems with this. So when we are doing an assessment, we want to make sure that the assessment is done in a appropriate place. It should be private. There shouldn't be distractions. We don't want to take a lot of notes that can make someone uncomfortable if they feel like we're writing down every word they say. We want to make sure that we kind of assess ourselves first to make sure that we don't have biases or judgments against this person. And we want to make sure that it is a comfortable experience for them, that we can communicate with them and we can be receptive of the information that they give us. And again, that self-assessment, we need to look at that. Do we have a bias or do we have discomfort in this discussion? So gender dysphoria is just being uneasy about your maleness or your femaleness. Some people say it feels like I was born in the wrong body. It feels like I am the wrong sex. Um, Usually this doesn't come up until people are older. Um, Parents who worry about children who um, maybe play as in stereotypical ways that the opposite gender would be like a boy that wants to play with a doll, a girl who wants to play with tools. they worry about maybe, oh, this may be a sign that this child may have a problem with gender. And it's usually not even on the radar until they're at least 3 years old or older, before they kind of identify themselves as a girl or a boy. Um, so your book says that this is extremely uncommon. Um, I don't think that's true. I think that it is something that has been hidden, and we are just starting to see the greater number of people who are saying that I don't feel like I am in the right body. I feel like I should be in the body of the opposite sex. Um, these people may also have anxiety and depression, that kind of goes hand in hand. Which comes first is kind of, is it the cart or the horse? Which one came first? Are they unhappy in their gender and that made them anxious or depressed? Or were they anxious and depressed, and then when they were looking for reasons with this, maybe they discovered they were unhappy with their gender. Psychosocial factors come into this, but there are also biological factors. The more research it's done, there seems to be a actual physiological differences for people who do have a gender dysphoria and those who do not, um, in brain structure. So that is under investigation, and I'm sure we'll hear more about that. But I really think that this is a hidden thing, and it is much more common than maybe the average person realizes. So, nursing process for gender dysphoria. Um, So in children, just making sure that they are psychologically adjusted, being supportive of the family, encouraging family therapy. Um, for adolescents and adults, individual therapy, family therapy, coping skills, um, maybe psychotherapy. And if they decide they really want to have sexual reassignment surgery, then they will go through a lot of psychological testing just to make sure that this is something that they actually really want to do. Um, Usually this starts with giving hormones. The hormones they're given block the natural hormones that are being produced by their body. So this will stop menstrual cycles and breast development in women. It will prevent the voice from lowering and decrease hair growth in males by giving hormones. Um, the sexual reassignment surgery is not necessary to have a gender dysphoria. You can be a transgender person who has not had sexual reassignment surgery. It's not required to consider the person being transgender. So your book has a lot of information on the paraphilic disorders. These are acts or stimuli that are outside what society considers normal, but some people require. These, in order to be a disorder, it has to have been going on for at least 6 months, and it has to have caused some type of interference or distress in this person's life, relationships, um, job. There has to be something that is problematic with this. So this is the list, and your book has a um, information about all of these in some detail. Some of these are illegal. Um, it is illegal to be an exhibitionist. It is illegal to rub up against people for sexual gratification in a crowd. It is illegal to have sexual relations with a person who is not of age. And it is illegal to look in people's windows to observe people having sex. So all those are illegal and can cause the person some problems. Some of the others, like a fetish disorder or a um, transvestite disorder, those are not illegal and they really don't even become a disorder unless they are causing distress to the person. Um, if this happens within a um, consenting relationship, even sadism and masochism. If this isn't a consenting adult relationship and there is no harm being done, then it is not considered a disorder. So lots of different things here, and your book gives a lot of details about these. So things that we want to do, we want to look, is there any potential for self-harm or any harm to others? We want to make sure that the person is not a victim um, or not a perpetrator, either one of those. Sometimes people will come out and tell you things like that. Um, they may want to tell you about the time they were arrested for having sex with a younger person or being found putting a camera in somebody's bathroom to try to watch a person while they're in there. So sometimes people want to give you that information, and that's where you have to get into that assessing yourself and making sure that you are able to do this conversation with this person and in a non-biased, non-judgmental way. So we want to focus on what the presenting problem is here and look at what the patient's perception of this impact is. Now, sexuality is not just disease. We also do teaching. Um, we also need to look at people who have medical issues and possibly their medical issues may affect how they feel about themselves. Thinking of the woman who has a mastectomy, she may not feel like maybe she is desirable anymore. She may feel like she is maybe less than a woman because of this, and be kind of afraid to talk about that. A man who's had a major heart attack, one of the questions he may have is, when is it safe for me to have sex again? Um, and they may be unwilling to ask that question. So that's where the nurse comes in with giving information that covers not only what pills you should take, what your diet should be, but what restrictions or lack of restrictions on your sexual activity should be. So nurses have while we don't fix any problems here, we certainly can bring them up. We can talk about them. We can teach so people are better informed.